Ibrutinib is available now in many countries in Europe for all patients with CLL. I think at this meeting we have the chance to evaluate longer follow-up data. So the safety of Ibrutinib when used in first line, and Alessandra Tedeschi presented the results of the RESONATE-2 study, is confirmed as a very effective and safe therapy over time, and most of the patients continue treatment, and in many cases the adverse events are occurring only in the first years of treatment, and then patients are tolerating treatment very well. So we have now this drug available at relapse and in first line. Unfortunately, in Italy, the use of Ibrutinib so far is restricted in first line to patients who are older than 75 years of age or are carrying TP53 aberrations. But based also on the results of the study presented at the ASH meeting last year, we hope that the drug would be available in the next future for all our CLL patients. We have longer follow-up of phase 1, phase 2 study, and now we have more mature data on phase 3 studies. For real-life data, of course, there is a sort of bias in data collection, so they are more restricted. I would say that the tolerability of the drug seems to be an issue in real life. So we would I think that in the next future we have to better understand the toxicity profile and how to manage the toxicity related to Ibrutinib and other novel agents in order to improve the management of our CLL patients.